This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page, and this is Doc Talk. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its member physicians giving information to patients or to the patient populations in the Knoxville and surrounding areas regarding information that's important to them that helps them make decisions regarding treatments or general information about the Knoxville area. And with that, I have with me today Dr. Darinka Malusnik. Dr. Malusnik is the county medical examiner for Knoxville, but you not only cover autopsies for Knoxville, but also Anderson County. And you do the autopsies for the area about basically deaths that are unattended, suicides, homicides, and that's what you do in the county or the county medical examiner's office.
That's pretty much in a nutshell.
Okay,
yes.
great. So I was trying to figure it out. I was trying to figure out to sort of generalize for people to sort of understand. And so in that capacity, the topic you wanted to cover today was regarding drug use and drug overdose in the Knoxville area.
Yeah, pretty much Knox County, greater Knoxville area, and Anderson County. But Knox County can be our focus because definitely Knox County has a larger, bigger problem than rural areas around the urban center.
So give us a general overview of the problem in the Knoxville area and the surrounding areas that you've experienced as the county medical examiner.
So I've been county medical examiner since 2002, chief since 2008. And of course, I've been following these trends very, very closely. It's close to my heart because these are all avoidable, preventable deaths. And that's why when medical examiner job is kind of explained, that we kind of fall in the prevention category, which a lot of times is kind of counterintuitive, but the essence of our work is that we can alert the public, the county, the citizens of what's going on, how to basically apply the known measures or come up with some new measures and preventative kind of attempts to prevent these deaths from happening in the future. Okay. So when we say we cover all the unexpected, unattended deaths due to violence, so that's essentially where the drug overdose deaths fall. And when I came here in 2002, I've relocated from a major urban area. Knoxville actually was not doing too bad. We cover surrounding 25 counties with autopsy service, so we kind of had some idea what's happening in East Tennessee in general. But over the years, the problem has become worse, more acute, and that's where all the kind of measures and organizations that kind of sprouted after that kind of drug overdose or opioid alert, came into place, such as Metro Drug Coalition. We started working together and try to get the word out, what's happening. Of course, we also work with the law enforcement. There is also kind of a law enforcement part of what we do. So all of these kind of measures have finally came together to, in 2019, result in some improvement. So in 2002 until 2018, things were getting worse and worse and worse. We came together as a community, implemented certain measures, legislative or educational, or even law enforcement measures, and then the improvement finally became real, became tangible in 2019. And then COVID struck, and then things just deteriorated again. So that's kind of summary of what has been happening, but it's an acute problem because every single day we see multiple drug overdose deaths, and that's just too many. From like a one a day to multiple day, that's something that we have been experiencing, and that short improvement in 2019, beginning of 2020, was so short-lived. Actually, we didn't even have a chance to celebrate kind of success or improvement in mortality, and then of course things just deteriorated precipitously. since March and April of 2020.
So coronavirus has had a deleterious effect on the number of drug overdoses. Why do you think that is?
I think it was closures and the separation and a lot of there are a lot of psychological mental issues that usually are linked to drug abuse and drug overdose deaths, and I believe all of that essentially people were losing jobs, the economic effect was definitely perceptible. And then, of course, all the other educational attempts and what Mental Drug Coalition was doing, essentially all of that kind of fell apart. I believe kind of the framework and the community connections sort of fell apart. And all these individuals who were maybe finding safe harbor or some help essentially were kind of left alone or found themselves with no help and no support, and resorted to drugs again. And a lot of that essentially was individuals just found home alone with drugs. And of course, obviously, there's a drug supply problem that although the prescription medication and opioid deaths from that have definitely improved, and we continue to see that improvement. And if I'm proud of anything, is that our work and our measures definitely help that kind of bring awareness to unsolicited or overprescribing of the medication, and essentially unsolicited kind of pain medication treatment that was not really necessary. So we did work in that direction and made really tangible improvements. However, when there is a large population of addicts in our community now, and without the support and without this framework of treatment or other kind of post-treatment support, they were essentially finding other ways of treating or basically, treating their withdrawal, and they were resorting to the illicit drugs, and they were readily available. Right. Of course, bad individuals with bad intentions and bad drugs are always around, and of course that now escalated, and that's where we're seeing illicit drug use that is causing
so
the increase.
the type of drugs you're talking about that were prescription drugs, those are all narcotic type drugs.
That's correct. Oxycodone was number one cause of that in drug overdose deaths for over a decade. It was consistently number one. Oxymorphone was actually getting high too, and hydrocodone, methadone were not so frequent, but fentanyl actually, like patches or lollipops, that was also getting on the market. So those were like the main drugs that we were encountering. And then, of course, when the prescribing improved and the practices of our colleagues improved, then of course that's when illicit drugs
So you think the limitations because I know that, and of course I'm sure some patients also know that if they've ever been prescribed in any form of narcotic, that whereas it used to be more available to get more of the drug more often,
yes,
now that's completely changed, has it not, as a physician,
yes,
in terms of prescribing?
Yes.
But despite that, and so you think that had a significant impact upon the numbers of overdose and overdose deaths to a certain degree?
Definitely, because
or at least temporarily?
At least temporarily, because that was the good thing. The problem was we did not really create a good kind of framework or support and to carry over and to help them with the withdrawal issues and other psychological issues that obviously need to be supported, and that's where the problem started.
So strictly restricting the legal form of the drug was helpful, but then the illegal form of the drug was more, at least not, if not readily available, was a way that these patients could treat their overdose. And so you see more of that, the use of the illicit drug now than you do of the legal drug.
That's correct. And in spite of that, again, we were making progress,
right,
but of course after the COVID and now all that support measures sort of were suspended, the illicit drugs definitely, their use increased tremendously. And of course, with the fentanyl analogs, and those are laboratory created illicit fentanyl and its analogs, of course methamphetamine also flooded the market. And that became essentially like a new kind of combination or new kind of speed combination, because as you might recall in the past, especially urban areas, it was heroin and cocaine. Well, now actually it's fentanyl with or without heroin and methamphetamine, which is very actually interesting trend too, because again, when I came here 2002, the big push for clandestine meth lab elimination was really at its height. And it was very interesting. I even kind of went, some homicides were connected to that, but the people were not necessarily dying from the drug. Well, now this pure lab-created methamphetamine is so strong, and it's high demand, and it's cheap, and we are seeing actually increase in overdose deaths from that too.
Now, as a patient or someone who might be listening to this who's not familiar with how some of these drugs differ from fentanyl, how is fentanyl typically used in a medical situation, and how is it, I mean, and so now it's become a drug of abuse. So anyway, it's something I found very interesting, that this is not a drug that's supposed to be readily available just to a patient who's not in a hospital.
Absolutely, yes. And we have to remember that how much stronger fentanyl is than heroin and morphine. Of course, you know, heroin breaks down into morphine, so essentially that's what it is, but it's so much stronger, so much more powerful, that takes very little. And that's why another problem that the ER physicians, our colleagues in the ER rooms, are encountering, because you can give naloxone and bring them back after they possibly overdose on morphine, heroin, or even oxycodone for that matter. But it takes much more effort and many more doses of naloxone to bring them back after they overdose on fentanyl or some other.
Now fentanyl is typically only used in operative situations, and it's also, medically for patients who have terminal cancer, correct? Isn't that usually the two forms?
Cancer, severe trauma, and surgery that requires like a kind of immediate relief right away. It's not really meant so much for long-term use, unless there is some debilitating condition or hospice situation for cancer.
So, so in terms of and I know this has been in the news lately. We heard about the judgment against Purdue, the large judgment against the Purdue company. It's I think it's in the billions of dollars. Is that correct?
That's correct.
To what extent do you find that the drug companies are liable for the overdose deaths in this area, or in the rest of the United States for that matter?
Well, I think they were really responsible, because they were really indiscriminately selling, so to speak, their drugs as innocent, easy to control, easy to manage, not non-addictive. Actually, if you remember that first article that everybody talks about, from Dr. Jiggs or whatever his name was, essentially it was not even an article. It was a letter. There was one paragraph that was then kind of recycled and cited so many times, stating that opioid deaths cannot really happen after like a judicious use of pain medication, and that's really not the case. These are really strong opioids that, if prescribed for a prolonged period of time, especially after there were studies that showed that after a year or three, especially like 3 years of constant use, it's almost inevitable that the patients are going to become addicts. It's just because of the tolerance and all the other issues that come.
Yeah, and addiction can actually be caused with a very small amount of the medicine as well. So, well, unfortunately, we talked about some of the, but we talked about the gains you all have made, and then unfortunately some of the gains which have been lost during the coronavirus epidemic. What is a bright hope that we should see? I mean, what is a take-home message from this as a patient that we should get from this information that you're giving to us today?
Well, the bright actually spot for me is that the overprescribing has definitely fallen to where it's supposed to be. Actually, very little prescription when it's needed, and very judiciously done and controlled and managed by the physicians. So that's actually kind of the bright side of this. Another bright side is that we do have actually the framework and sort of the foundation on which to build. One, we kind of get back to normal as far as we can function normally. We can bring these people together. The isolation is reduced, and so individuals and organizations that are really dedicated to helping the patients in need can function normally, such as like a Metro Drug Coalition that I keep supporting and bringing up, because I think they've really done a tremendous job locally. And there are other groups. There is also ASAP in Anderson County. They're doing a really good job too. But so there are these organizations that are ready to bring these patients back, to offer support and education and long-term rehab and kind of direct them. Obviously, there is another part of that as far as rehabilitation is concerned, because it doesn't take just a month or three.
Right.
It's going to be a long-term
Right.
process, but
Very costly and
it's very
long-term.
costly, and that's something that obviously not my area of expertise.
Right, yeah.
However, I think it's really important to remember that at least we are looking into it, at least as a healthcare community, we come together.
Right.
And I believe that awareness and coming together is really important sort of kind of building block in the future.
So the bright spot is we basically set up the framework.
That's correct.
By which everything can be done. So as opposed to all these piecemeal efforts, like efforts that were being done by law enforcement, or efforts that were being done by the physician community, and efforts that were being done by the legal, the legislative process, are all basically forming together, getting information from each other, and coming up with a unified plan that actually works much better than each individual organization sort of trying to take on the problem.
Absolutely.
By
And
itself.
even in our healthcare community, I'm seeing as communication with the ER physicians and the clinicians improves, that has been happening too. So even inside our healthcare community, we are coming together and getting information from each other it's very helpful. So we're not just kind of in our little silos of different subspecialties. It looks like that we are getting around the patients together as a healthcare community.
Well, Dr. Malusic, I know you don't see patients per se. You don't see
Right.
them unless.
But I see their families.
Right,
quite
exactly.
often.
I was going to say there's a lot of interaction you have on,
Yes.
with in the unfortunate circumstance when
Yes.
they have overdosed, and you do a lot of work with them, and even in other situations as well, and you work with attorneys and you work with police officers. But if I'm a patient, or if I'm someone who would like to get some additional information, are there any resources that you would like to give us, maybe from your office that they could have, or maybe a telephone number or an organization that they could contact to get additional information?
I think really, our office for the families that lost their loved ones and their loved ones came to our office, we always encourage them to call us and we can discuss it, because there's always somebody else in the family who can actually profit from this new knowledge, because believe it or not, sometimes these addiction cases are multi-generational in the same family, and there are either parents and the son and then the grandson or grandchild, in general. So they can always reach to us, and we are really easy to find. We even have a Facebook now, Facebook page that the overview of our office and how to reach us is Knox County Regional Forensic Center, and then our Facebook page and our website is going to pop up right away.
Great. So what we're going to do is we're going to put that information on the bottom of the screen while you're sitting here talking about it. So if anybody who's watching this, who's watching this broadcast currently can get the information from that, either a phone number or a website or
Right.
a Facebook page to get this additional information.
Right.
Well, thank you so much for sharing that information with us today. I mean, there certainly is, unfortunately, the downturn with coronavirus, but we've established a network by which things will really improve, once things start getting back to normal.
That's correct.
And thank you so much for joining me here today.
Thank you for having me.
And with that, this ends this podcast of Doc Talk. Doc Talk is a podcast that's produced by the Knoxville Academy of Medicine and features its physician members giving information to patients that are helpful in terms of giving them information on how they can gain treatment or get information about diagnosis and how to get in contact with physicians in the Knoxville area. I'm Dr. Rob Page, and thank you so much for joining us today.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.